It actually increases the size of the G-spot, makes it a little bit more accessible for sexual pleasure. So that's amazing. I mean, who doesn't want that, right?
Absolutely.
In this Backstage Pass series, we have authentic conversations about the evolving role that aesthetic procedures play in your life. We also dive into the often overlooked steps that you should understand before making the leap to your renewed self. These are the conversations that you want to hear, but just don't have access to until now.
Yeah, so PRP actually stands for Platelet-Rich Plasma, and so we explain to the patients, exactly what it is. And we will draw your blood, concentrate the growth factors out of the patient's own blood, and use those growth factors, for a lot of different reasons. And so it's been a great treatment.
For that particular patient, why did you choose PRP?
Right, so in the patient with hollowness under the eyes or dark circles under the eyes, we prefer PRP over filler for several reasons, one of which is significantly safer. You have, under the eyes there's a lot of blood vessels, and if you inject filler into one of those blood vessels, you can lead to blindness in that eye. But like I always say, you can inject a gallon of PRP into those vessels, it's not going to have any effect. Filler won't affect the dark circles under the eyes, but PRP is very effective with helping that. And it just builds up your own tissue, your own collagen, your own elastin, and I think it gives you a more natural look.
So when you guys do like the under eye PRP injections, how often would you recommend that? So that I'll know in the future.
Sure. I mean, I'd probably say about every 4 weeks for about 3 treatments, and then we'll kind of just do more of, just kind of when they want to come in after that, just to make sure that they're definitely not going to be depletion, we just want to have them maintain that.
I agree with Kristen. I think you get your best results with a series of 3 treatments. And then after that is sort of maintenance, for lack of a better word.
Yeah. Okay.
There also are a lot of women enhancements, so we can put it into the vagina. It actually increases the size of the G-spot, makes it a little bit more accessible for sexual pleasure. So that's amazing. I mean, who doesn't want that, right?
Absolutely.
So, and then also for men as well, on the flip side of that, it definitely can increase girth and length, basically, and just making that their orgasm, a little bit more enhanced.
Right.
Kristen and I both will do is, if we're doing filler, like in the cheeks or something like that, then we'll also add PRP at the same time. One, it will increase the natural collagen production in the cheek to accentuate the results of the filler, and 2, I think it makes the filler last longer.
I'm loving that lately, and I find that a lot of my patients are really loving that as well, because you actually get the benefits, like he was just saying, of the collagen production and everything, but you still have your filler there, so it's not like you don't have that fullness, so you get to have that fullness of the cheek while the collagen is working. So that basically when you're ready for, so that when your filler kind of goes away in a few months, that's when your collagen is already kind of built up. So it's really nice, Yeah,
and we're seeing really good results for hair regrowth in both men and women. You're getting a little thin on top as you get older, or whatever the case may be. But we're able to they'll stimulate the hair follicles that maybe have slowed down their growth, and some that have just become dormant and aren't growing at all. It can sometimes stimulate those to start regrowing hair, and the hair that's already there gets thicker, and it grows faster.
Yeah.